Hello cruel world, my name is Dr. Shaham Das. I'm a consultant forensic psychiatrist and I live and work in London. This particular video is about the process of being sectioned. So what it entails. It might be helpful for somebody who's got friends and families that they're worried about because they're psychiatrically unwell. So I'm going to talk about where it happens, how it happens, including problems that I've encountered and also why it happens. I didn't want to make the vid too long, so I'm not yet going to talk about the consequences, but I will do that in another video soon. So I'll be talking about what happens after somebody's sectioned, going to psychiatric hospital, what that means for them, the experience, etc. So look out for that. So where it happens depends on the context. So because I'm a forensic psychiatrist, I tend to section people directly from courts and also from prisons occasionally. Whereas for most people, they would be seen by the psychiatrist on call at the accident and emergency department. Increasingly, psychiatric hospitals have a special facility, like a small room that's a bit calmer and more isolated than a busy A&E department, which is known as a place of safety, and it's called a 136 suite. People can be brought in by police, they can be brought in by friends and families. They sometimes can just be seen wandering the streets and can be brought in by a whole range of people. So in terms of how it happens, you need 3 members of staff, 2 independent doctors, and they have to be independent. They can't know each other, work for the same hospital to make the process fair. At least one of whom has to be Section 12 approved, like I am. Section 12 approved means that that doctor is fairly senior, they've been through a certain amount of training, they have been through specific training to do with the Mental Health Act. They need references from consultants and they need to satisfy a Section 12 panel that they have the expertise and the knowledge to utilise the Mental Health Act and to section people appropriately. Also needs an AMP, an AMHP, an approved mental health practitioner. So that's usually a senior social worker who's also been through a lot of specific training about the Mental Health Act. So it's actually the AMP that does all the paperwork, that makes the application, and the doctors kind of back them up with their opinion. So the AMP has to also phone the relatives, and relatives are involved in the decision and the assessment as much as possible. In terms of the actual assessment, these 3 members of staff go into the room, they see the patient, they assess them. Usually I'd say about an hour, although it depends again on the circumstances. For example, if you've got a patient who's acutely unwell, psychotic, disturbed and can't really engage in conversation, then the assessment might be very simple, it might be very brief. There has to be a consensus from all 3. So if all 3 people agree, they do the paperwork, that patient is under section of the Mental Health Act and they're shipped to hospital. If 1 or more people don't agree that the person needs to be sectioned, then they're free to go. They're not detained under the Mental Health Act. So why are people sectioned? Well, that's kind of obvious, I think, because there are some concerns for the patient, whether it's friends or family, whether it's police, whether it's the person's GP, and there are worries that the patient can't function by themselves at home or in the community. The Mental Health Act has a lot of legalities and very specific criteria for somebody to be appropriate to be detained or sectioned. I'm not going to go through them all, I'm going to save you the time, otherwise it'd be a very long and dull video. But to summarise very briefly, the patient has to have an illness of a nature or degree that warrants hospitalisation. Nature is like a description of the previous history of the illness, so what caused relapses, what caused remissions. Degree is the intensity of the disorder at that exact moment in time. And it has to be such to be detained for their health, their safety, or the safety of others. And actually I have to say that the threshold is quite high. So you could be psychiatrically quite unwell, but still not be detainable. So to give you an example, there could be a man who's hearing voices that are insulting him as opposed to hearing voices telling him to hurt people. So because there's no risk and because he's able to function, he might not be detainable. Similarly, you might have, say, a woman who is depressed. She might be isolated, maybe she's sleeping poorly, maybe she lacks energy, but because there's no risk to self, there's no self-harm, no intentions of suicide, again, she might not be detainable. In those cases, we would try and treat the patient in the community first. There seems to be this common misconception that psychiatrists want to detain people or that we go out of our way to do that, and it's just simply not true. I mean, there's no incentive. We get paid the same whether we've got 1 patient on our ward or 20 patients. And in fact, you could argue that it's actually easier to do work with less patients. And also another big factor is that the availability of beds is limited, and it seems to be getting worse as time goes by. So it's actually quite hard to find hospital places for patients appropriately, especially in a timely manner. Just to illustrate this, I can tell you that I've been a medical doctor since 2003. I've been working exclusively in psychiatry since 2007, and it's been getting worse. So every year it is notably harder to find beds and to get patients into hospital. So in terms of the actual sections, in terms of civil sections, so the ones that the average person might be subject to, the two most common ones are Section 2 and Section 3. Section 2 is for an assessment and it lasts up to 4 weeks, although the consultant psychiatrist in charge of the patient can discharge them before that time. If the consultant wants to renew it, then at the end of those 4 weeks, they make a Section 3, which can last up to 6 months. Again, the consultant can discharge the patient anytime before then. If it gets to 6 months and the patient is still unwell, then it can be renewed by the consultant every 6 months indefinitely. There are other sections, for example, the criminal section of the Mental Health Act. That's the kind of stuff that I do. So for example, Section 37, a hospital order, that would take somebody from court directly to a secure, locked forensic unit for offenders. So I'd like to tell you a bit about the problems that a psychiatrist faces when they're trying to section people. Before I do that, I'd like to properly introduce myself. My name is Dr. 𝐏𝐬𝐲𝐜𝐡 𝐅𝐨𝐫 I'm a consultant forensic psychiatrist, and this is my channel, A Psych for Sore Minds. I assess mentally disordered offenders in courts and in prisons and in secure psychiatric units, and I'm also an expert witness for criminal trials across the UK. This channel has a whole range of mental health videos, some related to offending and violence, some more familiar to the average person. My USP, I think, is that I discuss real life cases with you in my longer videos. I release videos every Tuesday and every Friday. Generally, the Tuesday videos are long and detailed, talk about individual cases. The Friday videos, like this one, are brief summaries, which is an overview of the topic. So you need to subscribe, otherwise you're going to miss out, and we just can't have that now, can we? So to tell you about a couple of problems with the process of sectioning people, I have to say I face these more as a junior doctor. Now as a consultant, I have more authority, so it's easier to phone or escalate the problem and get it sorted out because of my position, but it never used to be like that. One massive problem is the jurisdiction. So AMPs, who I mentioned before, they work in different geographical areas, and often they're really busy and they don't want to do the Mental Health Act assessment unless they're absolutely sure that it belongs to them. And the patient's address, the place they were picked up, their last known address, and where their GP are registered are all reasons that it might be another geographical area or another borough in London. So often we get a lot of toing and froing and arguments between AMPs to decide whose patient it actually is. And sometimes this can delay the process of sectioning somebody for hours whilst your psychotic patient is sitting in accident emergency and there's a risk they might leave or become disturbed. It happens quite frequently. Another issue is actually a delay in getting the doctors together. So as I said, you need 2 independent doctors. It might not be that hard during the daytime, but imagine that somebody's come in the middle of the night who's psychotic. The AMP has to phone around and try and wake up doctors and ask them if they're able to do these assessments. Another massive issue is the lack of hospital beds, which I mentioned before. Sometimes there just isn't a bed available within the NHS trust, and so the patient has to go to a private hospital or has to go out of area, which is horrible for the patient because they're unsettled, away from home, away from their friends and family. Although I have to say, where I work in courts, it's a bit different because the patient is obviously locked in a custody cell downstairs, so there's no issue with them potentially leaving. So that's it for today. As I said before, I will do a video very soon about the consequences of being sectioned. So what happens to the patient afterwards, what happens in a hospital, the members of staff there, the process of rehabilitation, leave, medication, everything you need to know. So look out for that. And as I said, subscribe. Okay, stay euthymic, and remember, I love you.